Welcome to the KUMC COVID i2b2 and data informational session. As I said, my name is Maren Lawrence. I'm the Assistant Director for Product Design and Analysis in the Center for Medical Informatics and Enterprise Analytics. And on the line as well is Dr. Singh Song, Dr. Noor Abu. All right, Dr. Song, would you like to get us started?
Yeah, morning everyone. I'm Song. What we're gonna talk about today is we'll spend the first 15 to 20 minutes to go over the introduction and the three national and international efforts that we've been contributing to facilitate COVID-19 researches. And also, because of this participation, we're able to create this rapidly refreshed local data resources to facilitate COVID-19 researches for our local researchers. And then the second chunk of this info session, Marion will show cool demonstrations on how you can query COVID-19 cohort in Heron. So starting from the end of last year, COVID-19 has become this rapidly growing pandemic. And as of yesterday, there has been more than 3 million total positive COVID cases. And in the United States, there are more than 1.2 million total COVID cases, and then more than 73,000 deaths due to COVID-19. 80% of deaths were among adults older than 65 years old. And it has been observed that people with serious underlying medical conditions seem to be at higher risk of developing severe COVID-19 illness. However, the complete clinical picture of COVID-19 is still not fully known. So it is still a ongoing researchers to better understand COVID. And in order to support all of the COVID-19 related researchers, there has been a lot of national and international efforts on rapidly building up COVID-19 data resources, ranging from literature engines like Kaggle, LitCovid, Dimensions, to clinicaltrial.gov, which lists all the ongoing clinical studies related to COVID-19, to data repository for epidemiological data like the Johns Hopkins Visual Dashboard, and a collection of open data sets offered by Google. But above all, there has been ongoing efforts for multiple health institutions to put together EMR-based data repositories in order to better facilitate COVID-19 research, as this patient-level data can be used to answer more extensive questions. So 3 of the efforts that we are currently involved are 4CE Consortia, ACT COVID-19 Network, and the CORNET COVID-19 Plus Network. I'm gonna go over each one of them later. So here, the first, the 4CE Consortia, or Consortium for Clinical Characterization of COVID-19 by EHR. It's an international consortium for EHR data-driven studies of the COVID-19 pandemic, which is led by the i2b2 International Academic User Group. And the goal is to better inform doctors and epidemiologists and the public about COVID-19 patients with data acquired through the healthcare process. And this effort involved 96 hospitals across 5 countries, over 3 continents. They have their first preprints published on medRxiv, and they have this very nice a website with all the visualizations of their initial descriptions of this COVID cohort across this consortium, which is worth checking out. And then the other effort that we are part of is the Crew to Clinical Trials, or ACT Network. ACT Network was initially funded by NCAS to support cohort discovery for multi-center trials. And ACT has built this i2b2 based query tool, which can be used to do feasibility counts, which is run over 125 million patients from 44 sites across the United States. And in response to COVID, ACT has ensembled 9 sites to put together a test network, which is rapidly refreshed just for COVID-19 patients. Here are some links to see the details about what is this ACT network, and there's specific information on their COVID effort. And then the third effort that we're part of is the PCORNet COVID-19 Plus network. So PCORNet stands for Patient-Centered Outcome Research Network. It is a large, highly representative national patient-centered clinical research network. It consists of a 20 patient-powered research network, or PPRN, 13 clinical data research network, or CDRN, and 2 health plan research network, HPRD. So KUMC, we're part of Greater Plan Collaborative, or GPC, and GPC is one of the CDRNs. And then in response to COVID-19, PCORNet has ensembled 11 CDRNs of 28 sites to put together this COVID-19 Plus data repository. So here is like all of these sites from GPC are participating in it, I think. And then as a side note, PCORI also provide funding opportunities for COVID-19 researchers. And here's the link that you can look for different funding opportunities if you're looking for a certain this different opportunity and chances. So as everyone knows, all the EMR systems, they are have different health institutions, they have different formats. So one of the benefits of being part of this national network is, such as PCORNet, they create this common data model, which is a data model that has much better interoperabilities across all the different sites. So COVID-19, we also create common data models for the COVID-19 cohort across the 28 sites. So it's better to have an idea of this, what this common data model looks like, so that you can kind of envision if you want to look for a larger cohort across PCORNet, this is the data source you would like to use. So here are some quick summaries about the COVID-19 cohort that collected by the PCORNet 19 Plus network. So this is like a quick age distributions, most likely patients older than 45 years old. And then the highest proportion of comorbidities is actually hypertension within this cohort. Here are, so there's a higher proportion of obesities for this COVID cohort. And then you can, as you can see, this cohort ranges across different states. And there's a variety of labs that have been collected and rapidly refreshed for this cohort. As I mentioned, in response to all of these efforts, we're able to create a rapidly refreshed COVID cohort locally to support local researchers. So I will pass on to Marion to talk about that.
Great, thanks, Song. So Heron i2b2 data repository. This is our local search query tool where you can search data from multiple sources, including Epic O2, IDX billing data, and various registries. This data is refreshed every 1 to 2 months and is used for feasibility counts, to request de-identified data sets or identify data sets. On the right-hand side, you can see the various folders that we have integrated into Heron for users to search. Right now, Heron does not include the COVID data, but if you go to the next slide, we have set up a COVID-19 i2b2 at KUMC. This data is being refreshed weekly, and includes all patients who are seen at the University of Kansas Health System since 1/1/2020. And you'll see in the image, we'll have the lab tests for COVID that are not currently available for searching in Heron. So users must work with our team to request counts or data. And we are happy to run those for you, and we will do some demonstrations at the end. Do you want to go to the next slide? So this is what the interface looks like. And when we run all of the lab tests, on the left-hand side, you'll see that 4,073 tested patients. So the total population that we've brought into this mini cohort is 24,000 patients. There have been 4,000 who've been tested at KUMC, and then 337 who've tested positive. And again, this is being updated every week. So of the 337 positive, you can see the age distribution, gender, race, and vital status. So 16 patients have passed away, 299 are still living, and then 22 we do not know. But there's pretty even distribution between gender, males and females.
And we also have this capabilities of searching free text notes. And I will pass it to Noor to talk a little bit about that.
Yeah, thank you, Sang. Hello, everyone. So we are excited to announce that we have notes for COVID, and we are also providing a natural language processing service so we can extract concepts from the notes. As many of you know, so notes contains very valuable information. They contain physician interpretations, family histories, and many other information that are key to understand patients' conditions and in early detection their conditions and treatments. So the figure in the right shows where notes lives in Heron release. So in the visit notes folders, we have note types and result notes. So note types contains over 112 different physician types, including progress notes, ED notes, discharge summaries, and so on. In the result notes, we have the pathology and radiology impressions and exams. So we also here in the figure, we are showing the timeline. So after a user search for specific keywords, they can view the notes for a specific cohort. And in addition to search for specific keywords, they can also work with us to extract concepts using the natural language processing service that we are providing. So the NLP tool can identify the assertions for these concepts. So whether the concepts is presented in the patients or is it negated. And it also can identify the experiencer. So whether this concept is related to the patient or is it related to for example, a family member. And there are so many applications where we can use the NLP. So if you think about the COVID, we can extract signs and symptoms for symptoms that are not presented in the structured data or that are underreported by the EMR system. For our users, we are providing 20 symptoms that could be extracted from the notes. And this table shows these 20 symptoms. We selected these symptoms based on the literature review that indicate these are indicators or could be signs for COVID-19. And if users are interested in extracting these concepts, they can contact us. And if they need to extract different concepts, they also can contact us and we can work with them to customize their queries based on their needs. There might be special charges if they are requiring additional customizations. So if you're interested, just contact us and we will be happy to work with you.
Thank you,
Back
Nora.
to you, Mary.
Cool. So here is how you, the steps that you want to go over to request data for the local COVID cohort. Mary, you want to go over that?
Yes. In order to request the data, you do need IRB approval or a quality improvement letter of determination from the IRB. You'll need to build the query in Heron, and while you're not able to limit it to the COVID positive or COVID tested patients yourself, when you log the data request on the Heron homepage, please just specify if you would like us to only include COVID positive or all patients tested, and we will limit your query for you. Then the Heron team and the Data Request Oversight Committee will review the request, and we will provide the data in REDCap.
Cool. So yeah, so as we just mentioned, the whole GPC sites. Oh, sorry, Marian. There's this is the web page for the Heron.
Yep.
You want to continue with that? Sorry.
Oh, yep, you're good. Yes, this is the web page for Heron, and then you'll see the Heron data user recruitment request is on the bottom left. And then we do have beginner trainings the second and fourth Tuesday of every month from 12 to 1, and those are being held via Zoom. So you can also register on the homepage.
Cool. Thank you, Marian.
Yep, thank you.
Yeah. Since the whole GPC sites are participating this in the PCORnet COVID-19 Plus network, so if you want to have a larger COVID-19 cohort with better representativeness, you can also work with us to include multiple GPC sites. And the COVID cohort for the other GPC sites are very similar to our local COVID cohort. The data are refreshed at least weekly. For some sites, I think they're refreshed even daily. And all the patients are included as long as they're seen at any one of the GPC sites since January 1st, 2020, who have been tested for COVID-19 or who have had a diagnosis code for illness such as COVID pneumonia, influenza, bronchitis, or fever. So it's a cohort much larger than just COVID-19. Also have other respiratory illness. So if you want to do control case study, it's also doable because the denominator cohort is much larger than just COVID. And as of April 20th, there has been over 70,000 tested cases across the GPC sites, 11 GPC sites, and around 4,000 positive COVID-19 cases across the GPC sites. So here is a little breakdown of a number of cases, a number of tested cases, and a number of positive cases across sites. So in order to work with the whole GPC network, here are the steps you want to go through. Usually it starts from having a feasibility counts, which can help you to identify whether you want to work with all the GPC sites or some of the GPC sites. So it starts from prototype query locally against i2b2 or the PCORnet common data model that I just mentioned in previous slides. And then if you have decided what kind of cohort you want to collect and what are the variables, you can actually log a GPC feasibility or data request using this REDCap survey. And after this request been approved, we will send out your query to the targeted GPC sites, and they will collect the data and provide the data back in REDCap. As a quick note here, so the funding is required to request line items from GPC sites, but if you're only doing feasibility counts, we don't charge additional for that. And here, none of the things that we're talking about can happen without our great software and system engineering team. So I just want to give a big thanks to our great team for setting up these resources up so rapidly, which just happened the past 1 or 2 months, which is quite impressive. So before we move on to the cool demo Mary's going to show, do we want to go over some of the questions? I think we have used 23 minutes.
Yeah, let's take some time for some questions. I know people have been entering them in the chat box.
Okay.
Let's spend 5 or 10 minutes going through some questions.
Okay.
Keenan note, if we extract an identified list from the COVID subset, can we then supply those MRNs to then extract additional clinical information for those patients? Additionally, if we have an MRN list, can we extract COVID-related information and additional clinical information together, or would those need to be two separate submissions? We are able to pull the clinical information for the patients with COVID along with their COVID diagnosis. So we'll be able to pull all the data at once.
Mm-hmm. Which questions are you? Sorry, I just opened this chat box for some reason. Yeah.
Can you
Took me
see
a little while.
the Zoom chat box?
Is this the one?
I can't see it on your screen.
Oh, you can? Oh, I think I'm still sharing.
I'll read the questions.
Okay.
Doctor, you asked, why is the local COVID i2b2 data not freely available for Heron to KUMC? So currently, when we run the entire Heron code, it takes several weeks to refresh the data on the large population. So we will have the COVID data in there in our next refresh. And then as we go on, we can see about making the more fresh data available to users. But as of right now, it's not set up for users. And there was a question if we will provide the slides after the presentation, and we will.
Mm-hmm.
What was the rationale for including potentially non-COVID disorders? For example, influenza, bronchitis. Take that one.
Yeah. So the rationale, I think it is a decision made by the PCORNet consortium. And besides the COVID-19, any patients that had a diagnosis code for illness such as pneumonia, influenza, bronchitis, or fever are also included. But it's only restricted to a time frame after January 1st, 2020. Does that answer?
It was sort of about why, which you mentioned earlier, which is about some people want to do case control studies.
Yeah, some people want to not just look at the positive COVID or tested COVID, and there also could be a patient that could be potentially COVID but hasn't been tested. So yeah, so people want to do case control. They want to have negative the control groups. So the non-COVID cohort will serve as the control group, but they're mostly respiratory illness. Hope that answered the question.
Ashley asks, do we have to request the data every week? So you will not need to submit a new data request. Our team will have to figure out if users want this data refreshed every week or two, how we manage those requests. But you will not need to submit a new data request every single week if it's for the same study. Dr. Parente asked, wondering what the timeline is for review by the data oversight after a data request is made. Still a few weeks delay like data requests in the past. So typically we do provide data within 2 to 3 weeks. And if there is a tight deadline, we'll try to meet that as well.
And I think in terms of IRB, there's also expedited IRB for COVID-related work.
Yes.
Yeah. Okay, so I think that's all the questions we have so far.
Yep, it looks like just one more came in. Amberly said, since some patients seen at KUMC may have tested positive in an outside facility, will the numbers reflect those cases as well? Right now, what we were showing were only the tests at KUMC. And so we could search for the patients who've tested outside of KUMC, either via diagnosis codes or through the notes. But what we were showing were only tests that have happened at KUMC.
Mm-hmm. But we do have the data to identify the tests that are happening outside KUMC. There's another question coming in. If it takes 2 to 3 weeks to get the data, how frequently can the data be updated? Marion, do you want to take that one?
Yeah, Keenan, that's a great question. And I think our team will need to discuss that a little bit more internally as far as how often we can provide updated data. And we can get back to everyone, but we will try to meet the needs of all of your studies.
Oh, cool. Shall we move on?
Yep.
Okay. All right, so next is the most exciting part. Marin going to show cool demonstrations in Heron on how to use Heron to query the COVID cohort. Marin, I'm going to stop sharing, and you want to share your screen?
Yep, I will share my screen.
Wonderful.
All right. So everyone should be able to see my screen now. This is the Heron homepage. And you'll see on the right-hand side are the login credentials to log into Heron. You either need to be a faculty member or be sponsored. You need to complete your human subjects training and to sign our system access agreement. We have a number of online training materials on the left-hand side. So if you have any questions about how to search Heron, come and check out the online training materials. We do offer in-person training or while we're remote, virtual training. So the Lunch and Learn Clinic is traditionally our training time. So go ahead and register for that if you are interested. In order to request Heron sponsorship, you can click on the link here for Heron sponsorship. That allows you to get access to the system, or click on Heron data use or recruitment request to actually request a data set. So we'll go ahead and click Start Heron Search to get into Heron. I've got it up here as well. So this is what the interface looks like once you log in. In the upper left are the terms that you can search. In the middle is your workplace. You'll see a folder with your own username, and then you'll also see a shared folder. And then you'll see your previous queries down below. Heron is a drag and drop tool. So you can drag queries over. So if I wanted to search patients, I can look in the demographics folder. If I wanted to search for pediatric patients, I could go ahead and just drag over the folders of interest. So I could drag over 0 to 17. I would click Run Query, give it a name, 0 to 17 years old, and click Run. You'll see how long the query's been running in the bottom right, and then it's going to provide the answer. So 143,000 patients are currently 0 to 17 years of age. If I wanted to know how many of these are female, I could go ahead and put that into group 2. So things within one group are treated as or. So this is saying they're 0 to 9 or 10 to 17. And then things between group are and. So now it says that they're 0 to 17 and female. $66,000 patients are 0 to 17 and female. If I wanted to search, I'll just clear out that query. If I wanted to search, I know that as Song had shown, a lot of patients with COVID have hypertension. So if you are interested in searching for a hypertension population, you could come down here to the diagnosis folder. And scroll down to ICD-10. And we can find hypertension. So it's in diseases of the circulatory system, hypertensive diseases. I can open this up and pull over just the folders of interest. So if I'm interested in essential primary hypertension and hypertensive heart disease, I can pull that into group 1 and run query. I do recommend clicking the Run Query button frequently. as that's kind of like clicking the save button. If you drag over a lot of terms into your query and don't hit run, your query will not be saved. So we're looking at 245,000 patients. If we wanted to exclude patients who've passed away and exclude patients who are under 18, we only want to do an adult study, we can drag over 0 to 17 years of age and click exclude. We can also go into vital status and pull over deceased and deceased per the Social Security Administration. And those are automatically excluded when I add them into group 2 when the exclude button was already clicked. So if this is my cohort, you can give this query the name, and then you could submit a data request and ask us to limit this to only patients who have COVID, if that's what you're looking at. If you would like to study people who have COVID, who are still living, who are over 18, who have hypertension, you could submit this query to us. You would go to the Heron homepage, click on Heron Data Use or Recruitment Requests, list everyone who needs access to your data. I'll add Dan as a team member. And then if you are not a faculty member, you do need to search for your faculty member's name, select them and click Add Faculty Sponsor. That allows you to click this Done Choosing People button. You would come in here, fill out your study. If you're looking for hypertension, COVID patients, you'd fill out the title of your research, a description. If there's an urgent deadline, please give a date, how you plan to use the data, and then if you're requesting identified data, you will need to provide the IRB information, and then the saved search name in Heron goes right here. So I would put in hypertensive cohort, and in the notes you should note, please limit the query to COVID positive patients. So once our team receives that, we can then, we will then pull the data for you. So we have a second instance of i2b2, which has the ACT data. And so I'll go ahead and clear this out. And so I will rebuild the query for you in this instance. I'll go ahead and pull up the hypertensive cohort. I've already rebuilt it here. And so you'll see that this is on the smaller population that we were talking about, just those patients who've had the respiratory illness since 1/1/2020. So the number of patients with hypertension is also lower. We're looking at about 10,000 patients total. If I wanted to limit this to patients with COVID, I can go into here and I'll pull up the laboratory testing and pull any patient who has had a positive lab test. I can go ahead and run this query. And it will provide an answer. So 136 patients have had a COVID positive lab test and have had hypertension and are currently over the age of 18 and still living. We also had some people submit questions. They were looking at COVID positive and negative and smoking status. So I'll go ahead and just build that query. So under lab tests, again, I can just pull the any positive lab test. We could also look into diagnosis codes to get more patients as well. So, but for right now, I'll just use the lab test. Under history, we have tobacco usage. And then we have yes, that they've used tobacco. And we also have under smoking tobacco use, we have current every day, current someday, former, I'll look at current and past smokers. Former, heavy, light, and smoker current status unknown. You can go ahead and run that. We could do the same thing, build the same query, except for in place of the positive lab test, we could also run this on the negative population. And I've already run these queries. Okay, so that came up with 96 patients. And then if we look at the COVID negative who were smokers, we have about 1,500. Dr. Teg was looking for lysosomotropic drugs. And so I've prototyped a query with that as well. So we do have medication data available. And so I'll go ahead and show you how to search for that. Again, I'll start with my any positive patient. And then one of the examples was hydroxychloroquine. I can use the find search by names. Oh, sorry, I already had this up and going. And so if you limit it, it automatically starts as any category. But since I know that I'm looking for a medication, I'll search for medications and search hydroxy. And click find. And it pulls all of the hydroxychloroquines. So if I hover over this, I can see the path where the data resides. So this resides in our medications folder under antiparasitics, antiprotozoals, antimalarials. So I'll go back into navigate terms and I can go into my medications folder and I can open up antiparasitics, antiprotozoals, antimalarials, and then I can scroll down and find the medications I'm interested in. So I can pull this into group 2. And the nice thing about going back into the navigate terms, you'll notice that there's only 2 hydroxychloroquines to pull over. Instead of over here, there are more choices because they're not all rolled up into the folders. These folders will include multiple of the drugs. So if I run this, this is searching to see any patient who has had a positive lab test and has had the hydroxychloroquine prescribed or given. This is ever in the course of the time that they've been to KUMC. If I wanted to look specifically at the encounter when they were COVID positive, I can switch this to say selected groups occur in the same financial encounter. So without it in the same financial encounter, we saw 97 patients. If I run it within the same financial encounter, now this is saying that they have to have a COVID positive test and at the same time, they have to have the hydroxychloroquine. So 86 patients have had this during their encounter for COVID. You can continue to add as many medications as you're interested in. Dr. Teg had provided me with a list, and so I did look at all of those medications, and I pulled them into the query. So she had fluoxetine, and then you can see the rest on the screen. And so it looks like there are 90 patients, roughly 90 patients who've had one of those medications at the same time as having the positive lab test. If you look at those medications ever, not in the same financial encounter, but just treated independently, it looks like 119 patients have had the medication. So you can also request additional data. So if you wanted additional data on these patients, you could pull any other data elements that you want into a third group and treat it as what we call your shopping cart. So any variables that you want back the clinical data about the patients. We put together a query, and I will pull this up. Sean Murphy from Harvard, who helped create, I believe he helped create i2b2, which is the software that runs Heron. Their team has been doing research with COVID, and he had put together an initial list of data elements that might be of interest. So I've created that query, and you can see some of the elements that they're looking at. So race, language, pregnant, smoking use, various comorbidities, heart failure, cardiomyopathy, asthma, influenza. So there's a lot of data that they were looking at, and you could build a similar query with any of the data that you would want pulled on your population. In order to pull back the data on everyone, what we do is we just add gender to the group so that when the query runs and it does the and, we're not dropping any patients. So again, there's even more clinical data that they're looking at: height, weight, blood pressure, body mass index, pulse, respiration rate, and then a whole host of medications. Oxygen or ventilator, orderables, oxygen saturation, and then lab tests as well. So all of this data is available to be pulled on these patients. They also have discharge disposition, the departments that they were seen, and the encounter type, and then various symptoms like cough, dyspnea, headache, fatigue. So all of this data does reside in Heron. So as we look at some of the higher level folders, we've already looked at diagnoses. We do also have flow sheets. And I believe that this VDR flow sheet has some of the ventilator information. So if there was something that you wanted to look at, ventilation, that should be documented on a flow sheet. There's the settings here. And there are all of the other flow sheets that are entered into Epic. You can find them here. So we've looked at demographics, diagnoses, flow sheets. History had the social history. There are lab tests, so you can pull over and search on any lab test. Medications, orders, procedures. Visit details is big for the vitals, and also for where the patients have been seen. So the clinical service departments that they've been seen in, and then also the encounter type. So ambulatory visits, inpatient hospital stays are all located here. So are there questions at this time? I think I saw one come in, and I'll go ahead and take a look at that and then see if there are any other questions. Christina, you asked a great question. Is there possibly duplication if you pull current smoker and also heavy smoker? A person could be both. That is correct. A person could be both. When the system runs, the patient counts that you're seeing are distinct patients. So it's taking out any duplicates when it runs. So the counts are distinct patients. So it's always good to include all of the different ways. You know, if you're looking for smoker, you want to include all of the different ways that smoking could be recorded to make sure that you catch all of the patients in case it's only recorded one way. Similarly, for the hypertension, I had only shown ICD-10. For completeness, you could go back into the diagnosis tree and you could also pull the ICD-9 code. So for anyone who might not be aware, ICD-9 and ICD-10 are the coding systems for diagnoses. ICD-9 was the older coding system and ICD-10 is the newer coding system. So you might pick up a few more patients if you do also search the ICD-9 data. Looks like there might have been one more question that came in. In what format is the data results provided? If the search is based on a set of MRNs, will the results cross-tabulate to provide the individual data points by MRN? That's a great question. I'll go ahead and show what the data looks like. I have a training data set that is fully de-identified and even scrambled further. So I will pull that up. We do provide the data in REDCap. If I click on My Projects, I can click on Record Status Dashboard, and you'll see that there are 3 patients listed here, and then various forms. So if I click on the first form, this is the patient form. This is given on all patients that we pull out of Heron. You'll see a vital status, birth date, death date, age, sex, language, race, marital status, and religion. We'll provide this for all data sets requested. And then if there's IRB approval, we will also pull the MRN. I'm going to go ahead and jump to the visit details form. This researcher was looking for height and weight. And so we give a summary. So we'll give you the count. So how many times height has been recorded in their medical record, the first date, the last date, and then the last value. So all of that is within REDCap. However, you might want to be looking at their height over time. You might not just want the last value. So we do also provide in the file repository, we provide a zip folder which has line item data. So this, I can go ahead and download it. This is 1 row per fact, so it's a long, skinny table. This first column is the patient number. So you can see, I'm just going to highlight, this is all one patient. And again, this is fully de-identified. So this is patient 4364. And this is all of the data about them. I've highlighted these 3 rows. These 3 rows are their height. So we'll have the value for each time the height was recorded. So if you are interested in looking at all of the data, it is provided in this format, and our team can clean this up for you and provide. Most people end up wanting a spreadsheet that is wide, not long. So most people want MRN and then, you know, first height, date of diagnosis, etc. And so we can clean that up for you for a fee. Otherwise, if you're welcome to clean it up, and we do have tutorials about how to use SQL to clean up the data, or you can use any other program that you want to use. So Dr. Hassan asks, so the ACT COVID dropdown is not going to be viewable to us in Heron, right? Are we able to search, are we able to see or find the list of terms that the Harvard researcher had compiled? That is correct. Right now, the ACT COVID is not visible within Heron. However, in our next release, we should have the COVID positive and negative facts. And yes, I think I can share this query with you. And I can put it in the shared folder. We have shared, actually it might already be here, shared COVID-19, and it's already in that folder. So you can pull this query up to where it says query name, and you can take a look at some of the variables that they were interested in.
Do you want to show the query report view? It's a little nicer.
Oh, sure. Good idea.
So if we have IRB approval, should we just email and request the list of COVID-19 confirmed patients, or how should we proceed? Please
submit the Heron data request on the Heron homepage. So you'll need to fill out all of your IRB information. This is the Heron homepage, and then this is the Heron data user recruitment request.
Okay, thank you.
Yep, you're welcome. Yeah, and then this is the, like Dan was just saying, this is the query report. So this is for the query from Sean Murphy at Harvard, and all of the terms that he is interested in looking at. So yes, you can take a look at that, and you can also modify the query accordingly. So you're welcome to start with an already built query, and you could just delete, if you're not interested in what's in group 2, you could just delete group 2 and just go from there. So if you said that you were interested in everything he had in group 2, instead of having to rebuild it, you could just rely on what's already there. What other questions are there?
Thank you very much for recording this section. There's lots to learn. How can we revisit this recorded session?
We will see if we can post it online. And then I can email out the link to everyone who attended. Are there other questions? All right, well, if there are no questions, thank you all for attending. Please reach out to us at Heron at KUMC.edu and let us know if we can help you with your research. Submit data requests. We do have our Lunch and Learns the 2nd and 4th Tuesday of every month. So you can join us there if you'd like to get into the details of actually building your specific query. And yeah, thanks for joining, and thank you so much to our software engineering team again for all of their hard work getting this put together and working to get the performance running so that all the queries ran well today. So thank you, everyone.
Thank you, Marion.
Thank you, Song.
Thank you.
And everyone stay healthy.
Yes.
Nice job. Thanks.